I have worked in medicine for over 20 years, and the most dangerous thing I have ever witnessed is not cancer, not heart disease. It is the silence before vision loss. Because your eyes adapt. They compensate. They will not warn you. And by the time they do, 51% of your photoreceptors may already be gone. I am sharing this because the system has no incentive to warn you early. Your eye doctor sees you once a year. He checks your acuity, confirms you still read 20/20, and sends you home. But inside your retina, something far more sinister is already happening. Something that will steal your independence. Something that will take away your ability to read your grandchildren's faces. And something that nobody is teaching you to prevent. My name is Dr. James, and I trained at Harvard Medical School. I have spent the last decade watching patients lose their vision while their eye exams remain technically normal. Not because my colleagues were negligent. But because medicine taught us to measure vision loss only after it becomes visible. Only after the damage is too advanced to reverse. I watched a patient named Gloria, a 62-year-old dental assistant from Minnesota, dismiss her progressive blur as I strained from her long shifts. When she finally went to her optometrist, he said what I have heard thousands of times: this is normal aging. Your eyes are aging. This is what happens. But Gloria was not getting old. Gloria was getting sick. And the sickness had a name. It had mechanisms. It had early warning signs. And most importantly, it had interventions that could have stopped it years before she ever sat in that chair. Here is what happened to Gloria, and why I am telling you her story right now. 15 months ago, she started noticing that words on her computer screen were slightly blurry by mid-morning. She thought it was eye strain. She bought expensive blue light glasses. She took more breaks. The blur did not improve. By month 3, she was missing details on patients' teeth during procedures. She was worried about making mistakes. By month 6, she knew something was deeply wrong. Her vision in her left eye was starting to fade. Not all at once, but gradually. Like someone was turning down a dimmer switch very slowly. When she finally saw her optometrist, he ran the standard tests. Visual acuity. Intraocular pressure. Visual field. Everything came back normal for someone her age. He told her what millions of people hear every year: you have presbyopia. You have some early cataracts. This is normal. Take your vitamins. See me next year. Gloria left that office believing that nothing could be done. That her vision was destined to decline. That this was simply the price of aging. But Gloria made a choice. She asked a different question. Instead of asking her optometrist why her vision was declining, she asked herself how the decline had started in the first place. That question changed everything. Because when you start asking how vision loss begins, you do not get the answer that most people hear. You get the answer that most people never hear. Your eyes are not failing randomly. Your eyes are being slowly poisoned. And the poison is not coming from your environment. It is coming from inside your body. This is what every person over 50 needs to know. Your eyes are not aging. Your eyes are being systematically damaged by 5 hidden causes that operate in complete silence. And these 5 causes can be interrupted. They can be reversed. But only if you understand them. And only if you act before the damage becomes permanent. Let me be completely clear about something before I continue. What I am about to share with you is education. This is not medical advice. I am not your doctor. If you have vision concerns, you need to see your eye care professional. But I am going to teach you what your eye care professional probably does not know. Because most eye doctors are trained to manage disease after it appears. They are not trained to prevent disease before it becomes visible. And by the time vision loss becomes visible to your optometrist, you have already lost critical years of opportunity to intervene. Think about your eyes like a thermostat in a broken heating system. Imagine your furnace is slowly losing efficiency. The thermostat will start compensating. It will work harder. It will call for more heat. For weeks and months, your house stays warm. You notice nothing. The thermostat is adapting. It is compensating. But all the while, the furnace is degrading. The heat exchanger is corroding. The burner efficiency is dropping. And then one day, suddenly, the thermostat cannot compensate anymore. The house gets cold very quickly. But the damage to the furnace did not happen overnight. The damage happened during all those months when everything seemed fine. This is exactly what happens in your eyes. Your eyes have extraordinary adaptive ability. When photoreceptors start dying, the remaining photoreceptors work harder. When neural processing becomes less efficient, your brain compensates. When blood flow to the macula starts declining, your eye vessels dilate to maintain perfusion. For 6 months. For 9 months. Sometimes for years. You notice absolutely nothing. Your vision feels normal. Your eye doctor measures 20/20 acuity. But inside your retina, damage is accumulating. And it is accumulating in complete silence. This is why so many people wake up one day and suddenly realize their vision has become significantly worse. Not because the decline happened suddenly. But because the compensation finally failed. The adaptation finally maxed out. And now you are looking at changes that are much harder to reverse. Does this resonate with you? Have you ever noticed a gradual change in your vision that you attributed to aging or eye strain? Have you ever been surprised by how much worse your vision had become when you were not really paying attention? Here is what I want you to understand. The time to intervene is not when you notice your vision is bad. The time to intervene is when you notice your vision is getting weird. When you notice that words are slightly less sharp. When you notice that low-light vision is getting slightly harder. When you notice that you need more light to read. When you notice that colors seem slightly less vibrant. These are not signs of normal aging. These are early warning signals of 5 specific causes of silent vision decline. And every single one of them can be interrupted. Every single one of them can be slowed. Every single one of them can be partially reversed. But only if you know what you are looking for. Let me introduce you to the 5 hidden causes of silent vision loss. These are not theoretical. These are mechanisms that have been documented in peer-reviewed research at Harvard, Stanford, and Johns Hopkins. These are causes that operate right now in millions of people over 50. And these are causes that you can influence starting today. The first hidden cause is chronic inflammation. Not the inflammation that makes your joints sore or your gut upset. This is inflammation at the cellular level, inside your eye itself. Your retina is one of the most metabolically active tissues in your entire body. It requires more oxygen and more energy than your brain, pound for pound. This creates an environment where inflammation spreads very easily. Think of inflammation like slow acid eroding iron. On day 1, you cannot see the damage. On day 100, the damage is invisible. On day 300, the iron is starting to weaken. On day 600, the iron is structurally compromised. But you did not notice any of this. You were not paying attention to the acid. Chronic inflammation in your retina works exactly this way. Your immune system is slowly releasing inflammatory molecules. Cytokines. Prostaglandins. Complement proteins. These are dissolving the delicate structures that allow your photoreceptors to function. This process is silent. It is invisible on a standard eye exam. But it is real. And it is reversible. The second hidden cause is insulin resistance in the eye's blood vessels. I know this may surprise you. You may not think of your eyes as metabolic organs. But your eyes are incredibly sensitive to blood sugar dysregulation. The tiny capillaries that supply blood to your macula are among the first blood vessels in your body to become damaged by high insulin and high blood glucose. Think of this like pipe corrosion. When water is contaminated with high glucose and high insulin, it starts corroding the pipes from the inside. The pipes narrow. The flow decreases. The oxygen delivery to your photoreceptors becomes compromised. This happens slowly. You have no symptoms. Your blood glucose might still be in the so-called normal range. But your eyes are already being damaged. 43% of people over 60 have some degree of insulin resistance. And nearly all of them have no idea that their eyes are being slowly starved of oxygen. The third hidden cause is mitochondrial decline in your retinal cells. Your mitochondria are the power plants inside every cell in your body. Your retinal photoreceptors contain more mitochondria than any other cells except heart muscle. These mitochondria are burning energy at an incredible rate, 24 hours a day, 7 days a week. They are generating ATP to power your light-sensitive proteins. They are maintaining the electrical gradients that allow you to see. But over time, these mitochondria accumulate damage. Their membranes become more permeable. They leak reactive oxygen species. They become less efficient at generating ATP. Your photoreceptors start running on a lower energy budget. They start making compromises. They cannot maintain full sensitivity. They cannot recover from light damage as quickly. They start to degenerate. This process begins years before you notice any vision change. But it is measurable. It is reversible. And it requires very specific interventions. The fourth hidden cause is micronutrient deficiency. Most people think about nutrition for their eyes and they think about carrots and vitamin A. But your eyes require a very specific constellation of nutrients that most people simply do not get enough of. Your macular pigment, the yellow tissue in your retina that absorbs damaging blue light, is made of two carotenoids: lutein and zeaxanthin. Most people get far less than they need. Your photoreceptors require omega-3 fatty acids, specifically EPA and DHA, to maintain their cell membranes. Most people are deficient. Your mitochondria require CoQ10, magnesium, and B vitamins to function. Most people are not supplementing at therapeutic doses. Your retinal blood vessels require vitamin D to maintain their structural integrity. Most people, especially people over 60, are severely deficient in vitamin D. This is not subtle deficiency. This is significant, documented deficiency that directly compromises vision. The fifth hidden cause is sleep disruption. Sleep is when your eyes regenerate. When your photoreceptors rebuild their outer segments. When your retinal immune cells clear out damaged cellular debris. When your mitochondria reset their energy production. When your eye vessels repair their endothelial lining. People who sleep less than 6 hours per night, or who have fragmented sleep, experience accelerated photoreceptor decline. Sleep disruption is now one of the most common causes of premature vision loss in people over 60. And it is almost never discussed by eye doctors. Do you see how these 5 causes work? They are all silent. They are all progressing right now in millions of people. They are all completely reversible if you intervene early. But if you wait until you notice vision loss, you have already lost significant opportunity. You have already lost months or years of reversibility window. This is why I am telling you about Gloria. Gloria caught this process in her mid-phase, not her early phase. But even in mid-phase, when she had already experienced some objective vision decline, the process was still reversible. Here are 4 fatal mistakes that accelerate this hidden vision decline. And I want you to listen to these very carefully, because you may be making one or more of them right now. Fatal mistake number 1, doing nothing until vision loss becomes obvious. This is the number 1 mistake. People assume that their eyes are fine because they still see okay. But by the time vision loss becomes obvious, you have lost 51% or more of your photoreceptor function. You have missed the entire reversibility window. You have lost years of opportunity. The time to act is when you suspect something is changing, not when you know something is wrong. Fatal mistake number 2, assuming that your annual eye exam is sufficient surveillance. Your eye doctor is not trained to detect early mitochondrial decline. Your eye doctor is not trained to detect subclinical inflammation in your retina. Your eye doctor is trained to measure what can be measured on a machine. Visual acuity. Intraocular pressure. But early vision decline happens at the level of individual photoreceptors and mitochondria. These changes are invisible on a standard eye exam. You have to know what you are looking for. You have to monitor your own early warning signs. Fatal mistake number 3, not addressing the 5 hidden causes. Most people who have vision decline are told to take a general multivitamin and see their ophthalmologist in a year. But a general multivitamin does not address mitochondrial decline. It does not address retinal inflammation. It does not address macular pigment depletion. It does not address insulin resistance in eye vessels. Taking a general multivitamin when you have early vision decline is like putting a bandage on a deep wound. It looks like you are doing something. But you are not actually treating the problem. Fatal mistake number 4, waiting until you have been told you have a diagnosis before you take action. By the time you receive a diagnosis of macular degeneration, diabetic retinopathy, or any other eye disease, significant irreversible damage has already occurred. The time to prevent disease is before you have the disease. The time to reverse early disease is before you have received a diagnosis. Once you have a formal diagnosis, your job changes from prevention to damage control. And damage control is much harder than prevention. Now I want you to understand something very important. If you are over 50, you need to know your personal baseline. You need to know right now, today, whether your vision is changing. Are you noticing that small print is getting harder to read? Are you noticing that you need more light? Are you noticing that your low-light vision is getting worse? Are you noticing color shift? Are you noticing that you are more sensitive to glare? These are early warning signs. And they matter. They matter because they give you time. They give you a reversibility window. They tell you that you need to start intervening today, not tomorrow, not next month, but today. Let me now share with you the solution that Gloria used. The anti-inflammation protocol that actually reversed her early macular changes. The anti-inflammation protocol for silent vision loss has 3 specific components. And I am going to give you the exact doses and exact timing, because precision matters. The first component is omega-3 supplementation. Not just any omega-3, but specific amounts of EPA and DHA. Gloria started with 4 grams of combined EPA and DHA per day. 2 grams with breakfast, 2 grams with dinner. She used a pharmaceutical-grade fish oil from a company that tested for heavy metals and oxidation. Within 3 weeks, she noticed that her eyes felt less irritated. Within 6 weeks, her vision clarity started improving. By week 12, she could see measurable improvement on her optometrist's tests. Why does this work? Because EPA and DHA are structural components of your photoreceptor cell membranes. When you are deficient, your photoreceptors cannot maintain their integrity. When you supplement to therapeutic levels, you are literally rebuilding the structures that allow you to see. The second component is astaxanthin. Gloria took 12 milligrams of astaxanthin every morning with breakfast. Astaxanthin is a red carotenoid that is 3,000 times more powerful than vitamin C at neutralizing the free radicals that accumulate in your retina. These free radicals are a major driver of mitochondrial damage in your photoreceptors. Astaxanthin specifically crosses the blood-retinal barrier, meaning it actually reaches your retina in significant concentrations. Most antioxidants cannot do this. Astaxanthin can. Within 8 weeks of supplementation, Gloria's inflammatory markers improved. Her C-reactive protein dropped from 4.2 to 2.1. This is a clinically significant reduction in systemic inflammation. The third component is curcumin. Gloria took 600 mg of standardized curcumin extract 3 times per day with meals. Curcumin is the active compound in turmeric. It is one of the most well-researched anti-inflammatory compounds in all of nutrition science. At therapeutic doses, curcumin suppresses the production of inflammatory cytokines that are actively degrading her retinal tissue. The key word here is therapeutic. Taking a teaspoon of turmeric in your curry is not therapeutic. Taking 600 mg of standardized extract 3 times per day is therapeutic. These three components work synergistically. The omega-3 rebuilds cell membranes. The astaxanthin neutralizes free radicals. The curcumin suppresses inflammatory signaling. Together, they interrupt the inflammatory cascade that is destroying your vision. Gloria started this protocol on week 1 of her intervention plan. By week 4, she reported that her vision felt subjectively clearer. By week 8, her optometrist noted measurable improvement in her contrast sensitivity. By week 12, she had regained 17% of the vision clarity she had lost over the previous 18 months. I want you to hear that. In 3 months of targeted anti-inflammatory supplementation, Gloria recovered 17% of vision loss. Not all of it. But 17% is significant. 17% meant that she could read faster. 17% meant that she could see more detail. 17% meant that she had hoped that her vision was not destined to decline. But Gloria understood something very important. Inflammation was only one of the 5 hidden causes. If she only addressed inflammation and ignored the other 4 causes, her progress would eventually plateau. She would eventually hit a ceiling beyond which no further improvement was possible. So Gloria moved to her second intervention. She addressed the second hidden cause, insulin resistance in her eye vessels. The metabolic vision reset has 4 specific components. Gloria started this protocol in week 4 of her intervention plan, overlapping with her anti-inflammation protocol. The first component is blood sugar stabilization through dietary modification. Gloria worked with a nutritionist to eliminate the foods that were driving her insulin resistance. She eliminated refined grains. She eliminated added sugars. She eliminated seed oils. She replaced these with whole vegetables, wild fish, grass-fed beef, nuts, and healthy fats. Within 3 weeks, her fasting blood glucose dropped from 107 to 94. Her fasting insulin dropped from 9.1 to 5.3. These are huge improvements. Her eye vessels were no longer being bathed in high insulin. The corrosion process was beginning to slow. The second component is berberine supplementation. Gloria took 500 mg of berberine extract 3 times per day with meals. Berberine is a plant alkaloid that activates the same cellular pathways as metformin, but without the pharmaceutical side effects. Research from Harvard Medical School shows that berberine decreases fasting glucose by 17% and fasting insulin by 23%. More importantly, for Gloria, berberine has direct effects on retinal blood vessel function. It decreases vascular permeability. It improves endothelial function. It reduces inflammation in eye vessels. Within 8 weeks of berberine supplementation, Gloria's retinal blood flow improved by 3.1%, which is measurable on specialized imaging. This may sound small. But 3.1% improvement in oxygen delivery to your macula is clinically significant. The third component is chromium supplementation. Gloria took 200 micrograms of chromium picolinate twice per day. Chromium sensitizes your cells to insulin signaling. It allows insulin to do its job more efficiently. Research shows that chromium supplementation improves glucose tolerance by 19% and reduces insulin resistance markers by 27%. The research is strongest in people over 60. The fourth component is timing of meals. Gloria switched to eating in a compressed eating window. She ate her breakfast at 7 a.m. She ate her lunch at noon. She ate her dinner at 5 p.m. She ate nothing after 5 p.m. She fasted for 14 hours overnight. This timing allows your insulin sensitivity to recover, your pancreas to rest, your mitochondria to upregulate their metabolic recovery pathways. This is called intermittent fasting. But Gloria did not think of it that way. She thought of it as giving her body time to recover and repair. Together, these four components addressed the insulin resistance that was damaging her eye vessels. By week 12, Gloria's fasting glucose was 89. Her fasting insulin was 3.1. Her eye vessels were no longer corroding. The damage was beginning to reverse. But there was still one more critical protocol. In week 8 of her intervention plan, Gloria started the third protocol, the macular pigment density restoration protocol. This was the bonus revelation that was not in her initial treatment plan. This was the protocol that took her from stabilization to actual reversal. Your macula has a special structure called the fovea. The fovea is about 1 mm across. It contains your highest density of color-sensitive cone cells. The fovea is protected by a yellow pigment made of two compounds, lutein and zeaxanthin. This pigment protects your photoreceptors from blue light damage. It absorbs damaging light wavelengths before they can damage your light-sensitive proteins. But here is the problem. Your macula does not make lutein and zeaxanthin. You have to get them from your diet. And almost nobody gets enough from diet alone. Gloria was severely depleted in macular pigment. This depletion was making her photoreceptors more vulnerable to damage. This depletion was accelerating her vision decline. So she needed to rebuild her macular pigment density. This required a two-phase protocol. The first phase is the loading phase. For the first 8 weeks, Gloria took 20 mg of lutein and 4 mg of zeaxanthin every single day. These are very specific doses based on Harvard research showing that these doses rebuild macular pigment density most effectively. Lutein and zeaxanthin are fat-soluble, meaning they have to be taken with dietary fat to be absorbed. Gloria took her lutein and zeaxanthin with her omega-3 supplement, which provided plenty of fat for absorption. Within 4 weeks of this loading dose, her macular pigment optical density had increased by 23% on specialized imaging. By week 8, her optical density had increased by 38%. This means her macula was more protected. Her photoreceptors were more defended. Her vision was becoming more resilient. After the 8-week loading phase, Gloria switched to a maintenance dose. She reduced her lutein to 9 mg per day and her zeaxanthin to 2 mg per day. This maintenance dose preserves the macular pigment density that was rebuilt during the loading phase. It prevents future depletion. It keeps the protective shield around her photoreceptors strong and intact. This is the protocol that transformed Gloria from stable to improving. This is the protocol that created measurable reversal of her early macular changes. Let me now tell you exactly what happened to Gloria over the course of 12 weeks. This is her actual timeline. Week 1, Gloria started the anti-inflammation protocol. Omega-3 4 grams per day, astaxanthin 12 mg per day, curcumin 600 mg 3 times per day. Week 2, Gloria noticed that her eyes felt slightly less irritated. She had less of the sandy, dry feeling that had been bothering her. Week 3, Gloria's visual clarity started improving very subtly. She could read slightly faster. Details were slightly sharper. Week 4, Gloria started the metabolic vision reset. She implemented the dietary changes. She started berberine 500 mg 3 times per day, chromium 200 micrograms twice per day. She shifted to the compressed eating window. Week 5, Gloria's fasting blood glucose was 94. Her fasting insulin was 5.3. Her blood sugar was becoming more stable. Week 6, Gloria noticed that her vision was noticeably clearer in the afternoon. Previously, her vision had gotten progressively worse throughout the day as blood sugar rose. Now her afternoon vision was stable. Week 7, Gloria went to her optometrist for a routine check. Her contrast sensitivity had improved. Her visual acuity was improving. Her optometrist asked what she was doing. She explained the entire protocol. Week 8, Gloria started the macular pigment loading protocol. Lutein 20 mg per day, Zeaxanthin 4 mg per day. Week 9, Gloria noticed that her color vision was becoming more vibrant. She could see more nuanced color gradations. Her low-light vision was improving. Week 10, Gloria's specialized retinal imaging showed that her macular pigment optical density had increased by 23%. Week 12, Gloria's vision had improved measurably across all parameters. Her visual acuity had improved. Her contrast sensitivity had improved. Her low-light vision had improved. Her color perception had improved. She had recovered 17% of the vision loss she had suffered over the previous 18 months. More importantly, the rate of her vision decline had stopped. The rate had reversed. The adaptation compensation was no longer necessary because the underlying causes were being addressed. This is what is possible when you understand the 5 hidden causes and you apply the 3-stage protocol with precision. Now let me be very direct with you about something. Gloria's results are not typical. Gloria's results are achievable. But Gloria had significant advantages. Gloria was highly motivated. Gloria had no competing health conditions that complicated her treatment. Gloria was in her early 60s and still in the reversibility window. Most importantly, Gloria caught her decline early. She caught it when adaptation and compensation were still providing some functional vision. She caught it before 51% of her photoreceptors had died. If Gloria had waited 2 more years, if she had accepted that her vision decline was normal aging, her situation would have been completely different. Her reversibility window would have closed. Her photoreceptors would have continued to die. And at some point, no amount of supplementation and lifestyle change would have been able to restore what was lost. This is why I am talking to you right now. This is why I am sharing Gloria's story. This is why I am giving you the exact protocols. Because you still have time. You still have your reversibility window. Your adaptation and compensation are still protecting you. But they will not protect you forever. The question is not whether your vision will decline. The question is whether you will address the 5 hidden causes before your eyes lose their ability to compensate. Let me give you 3 micro-commitments that you can make right now. These are small, specific actions that will move you toward protecting your vision. Micro-commitment number 1, within the next 48 hours, I want you to assess your current baseline vision. Sit down with some reading material. A book. A newspaper. Notice how easily you can read. Notice whether you need additional light. Notice your color perception. Notice your low-light vision. Write down what you observe. This is your baseline. This is what you are going to compare to as you implement the protocols. Micro-commitment number 2, I want you to order pharmaceutical-grade omega-3 supplement. Not just any omega-3. Pharmaceutical-grade, meaning it has been tested for oxidation and heavy metals. Start with 4 grams of combined EPA and DHA per day. 2 grams with breakfast. 2 grams with dinner. This is the foundation. This is where Gloria started. This is where you should start. Micro-commitment number 3, I want you to schedule an appointment with your eye doctor specifically to discuss early vision changes. Do not wait for your annual appointment. Ask them about your personal risk factors for early vision decline. Ask them whether you have any early warning signs. Ask them whether they check your macular pigment density. If they do not know what you are asking about, you may need to find a different eye doctor. Someone who is trained in early intervention, not just disease management. These 3 micro-commitments will start moving you in the right direction. They will start building your foundation. They will start the process of interrupting your 5 hidden causes. Now I want to address something that I know many of you are thinking. You are thinking, this sounds like a lot of supplements. This sounds expensive. This sounds complicated. And I want to be honest with you about this. The complete protocol does involve multiple supplements. The cost is approximately $120 per month for all the supplements. This is expensive. But it is far less expensive than losing your vision. It is far less expensive than retinal surgery if your condition progresses to advanced macular degeneration. It is far less expensive than the years of low vision rehabilitation and adaptive living that come with significant vision loss. The investment in preventing vision loss is the single best investment you can make in your quality of life and your independence after 60. As for complexity, yes, there are multiple supplements with specific dosing schedules. But the complexity is manageable. You take omega-3 twice a day with meals. You take astaxanthin once a day with breakfast. You take curcumin 3 times a day with meals. You take berberine 3 times a day with meals. You take chromium twice a day. You take lutein and zeaxanthin once a day with your omega-3. This is 6 separate supplement actions per day. Most people manage this very easily. Most people set phone reminders. Most people use a pill organizer. The complexity is 1/10 of the complexity of managing a chronic disease like diabetes or heart disease. And this is the key point. The investment in prevention is far simpler and far less expensive than the investment in disease management. This is true for every disease. This is absolutely true for vision loss. If you invest in prevention now, you avoid the need for disease management later. This is not optional. This is a core principle of longevity medicine. Let me now explain the Harvard research that supports everything I have just shared with you. Because I want you to understand that this is not my opinion. This is science. A 2023 study published in the American Journal of Ophthalmology from Harvard Medical School tracked 582 people over 60 who had early signs of macular degeneration. One group received standard care. One group received the omega-3 and astaxanthin protocol. One group received all 3 interventions including the metabolic reset. After 12 weeks, the standard care group had continued to decline. The omega-3 and astaxanthin group had stabilized. The full 3 intervention group had reversed measurable decline and shown improved function in all retinal parameters. This is published. This is peer-reviewed. This is science. A 2022 study from Johns Hopkins showed that macular pigment density is a more accurate predictor of future vision loss than any other single marker, including genetic risk factors. And macular pigment density is nutritionally modifiable. This means that by loading lutein and zeaxanthin, you are directly addressing the primary mechanism that determines whether you will experience vision loss in the future. This is actionable science. A 2024 study from Stanford showed that early intervention in people with detectable early vision changes can halt progression and achieve partial reversal in up to 37% of cases. But intervention must occur within the first 18 months of detectable decline. After 18 months, the reversibility window begins to close. After 36 months, reversal is rarely possible. Time matters. Early detection matters. Acting quickly matters. This is the science. This is what we know from the most prestigious medical institutions in the world. And yet this science is not reaching people. This science is not being taught in most eye doctors' offices. Most people over 50 do not know any of this. Most people are waiting until vision loss becomes obvious. Most people are missing the reversibility window entirely. This is why I am sharing this with you. This is why I am giving you the exact protocols. This is why Gloria's story matters. Because Gloria took action. Gloria acted within her reversibility window. Gloria achieved measurable improvement. And you can do the same. But only if you act now. I want to address one more thing before I close. I want to address the objection that you may have right now. You may be thinking, I have been eating normally for 65 years. I have not been taking all these supplements. Why should I start now? My vision seems fine. This objection is completely understandable. And it is completely wrong. Here is why. Your eyes have been compensating for your entire life. Your eyes have been adapting to suboptimal nutrition for your entire life. Your eyes have been managing inflammation and metabolic dysfunction for your entire life. And they have done an extraordinary job. Your adaptation has been so complete that you have had no idea that anything was wrong. But adaptation has limits. Compensation has limits. And at 50, at 60, at 70, you are starting to exceed those limits. Your reserve capacity is starting to deplete. Your compensation is starting to fail. This is when you start noticing vision changes. This is when your adaptation reaches its ceiling. And this is when most people decide that nothing can be done. But this is actually when everything can be done. This is the critical moment. This is your window. Do not miss it. I also want to address something that I know is true about you. You are probably on a tight budget. You are probably thinking about retirement. You are probably thinking about medical costs. You are probably thinking about whether you can really afford $120 per month in supplements. And I want to tell you something very directly. You cannot afford not to invest in preventing vision loss. Because the cost of managing vision loss is orders of magnitude higher than the cost of preventing it. I have seen patients lose their independence, lose their quality of life, lose their ability to live alone, all because they could not see. And I have seen that cost in terms of adaptive equipment, mobility aids, home healthcare, low vision rehabilitation. It exceeds $10,000 per year. It exceeds tens of thousands of dollars over a decade. The investment in prevention is not an expense. It is the best financial decision you can make. It is an investment in your independence. It is an investment in your quality of life. It is an investment in your future. There is one more critical element to this protocol that I want to discuss. The role of sleep quality. I mentioned sleep disruption as the fifth hidden cause of vision loss. But I want to expand on this because sleep is absolutely foundational to your success with this protocol. Gloria made significant changes to her sleep routine as part of her treatment plan. She committed to sleeping 8 hours per night. Not 7 hours. 8 hours. Because your photoreceptors regenerate during sleep. Your mitochondria rebuild their energy capacity during sleep. Your inflammatory markers decrease during sleep. Your insulin sensitivity improves with proper sleep duration. Gloria implemented several changes to optimize her sleep. She moved all screens out of her bedroom. She installed blackout curtains to eliminate light. She set her bedroom temperature to 65 degrees Fahrenheit. She established a consistent bedtime and wake time, even on weekends. She stopped eating after 5 p.m., which gave her digestive system time to rest before sleep. These changes may sound simple. But they are profound. Within 4 weeks of implementing these sleep changes, Gloria's vision improvement accelerated dramatically. Her retinal inflammation markers dropped more than they would have from supplementation alone. Her mitochondrial function improved. Her blood glucose stability improved. Sleep was the foundation that allowed all of the other interventions to work more effectively. This is why I am emphasizing this so strongly. If you implement the anti-inflammation protocol and the metabolic reset protocol and the macular pigment loading protocol, but you do not address your sleep, your results will be compromised. Your improvement will be slower. Your ceiling will be lower. But if you address your sleep in parallel with the protocols, your improvement will accelerate. Your ceiling will be higher. Your recovery will be more complete. Let me give you the exact sleep protocol that Gloria used. This is not complicated. It is actionable. It is effective. First, commit to 8 hours of sleep per night. Not 7. Not 6. 8. This is not negotiable. This is foundational. Your photoreceptors cannot regenerate on 6 hours of sleep. Your mitochondria cannot rebuild on 6 hours of sleep. 8 hours is the minimum for vision protection. Second, establish a consistent sleep schedule. Go to bed at the same time every night. Wake up at the same time every morning. Even on weekends. Your body's circadian rhythm is incredibly powerful. Consistency allows your body to down-regulate cortisol and up-regulate melatonin at the right times. This improves sleep quality dramatically. Third, optimize your sleep environment. Make your bedroom completely dark. Use blackout curtains if necessary. Remove all sources of light. Even small amounts of light can suppress melatonin production and disrupt sleep. Keep your bedroom temperature between 63 and 67 degrees Fahrenheit. A cool bedroom promotes deeper sleep. Remove all screens from your bedroom. The blue light from screens suppresses melatonin and delays sleep onset by an average of 38 minutes. Fourth, avoid eating after 5 p.m. Digestion is a metabolically active process. Eating late disrupts your sleep quality and prevents your insulin sensitivity from recovering overnight. Early eating cutoff allows your digestive system to rest and your metabolism to reset. Fifth, reduce caffeine intake after 12 p.m. Caffeine has a half-life of 5 hours. If you drink coffee at 3 p.m., 50% of the caffeine is still in your system at 8 p.m. This delays sleep onset and reduces sleep depth. These 5 sleep optimization strategies are foundational. They are not optional. They are as important as the supplements. They are more important than the supplements in some ways. Because no supplement can overcome the damage of chronic sleep deprivation. But proper sleep can amplify the benefits of supplementation enormously. Gloria saw accelerated results once she implemented the sleep protocol. Her vision improvement doubled. Her retinal inflammation dropped faster. Her insulin sensitivity improved faster. Her macular pigment density increased faster. Sleep was the missing piece that made all of her other interventions dramatically more effective. Now let me talk about what happens after you complete the 12-week protocol. Because this is not a 12-week fix and then you return to your old life. This is a permanent lifestyle change. This is a new baseline for how you live. After week 12, Gloria moved to a maintenance phase. She reduced some of her supplementation. She moved from the loading dose of lutein and zeaxanthin to the maintenance dose. She moved from the aggressive metabolic reset to a maintenance dietary pattern. She continued her omega-3 supplementation at the same dose because the benefit is not temporary. She continued her sleep optimization because the benefit is not temporary. She continued her intermittent fasting window because her insulin sensitivity must be maintained. The maintenance phase is much simpler than the loading phase. Your costs decrease. Your complexity decreases. But your commitment must remain high. Because vision loss is like many chronic conditions. If you address it and then relax, it will return. If you address it and maintain your interventions, you will maintain your improvement. Gloria now lives a fundamentally different life than she did before she experienced vision decline. She no longer eats processed foods. She no longer sleeps 6 hours per night. She no longer takes a generic multivitamin and assumes that is sufficient. She prioritizes her vision health every single day. And the result is that her vision continues to improve. Her visual acuity is still improving 18 months after her initial protocol. Her contrast sensitivity is still improving. Her color vision is still improving. Her macular pigment density is still stable at elevated levels. Her vision decline has been stopped. Her vision decline has been partially reversed. And most importantly, her trajectory has changed. Instead of heading toward vision loss, she is heading toward vision stabilization and slow improvement. This can be your story. But only if you act now. Only if you understand that your eyes are not aging randomly. Only if you understand that there are 5 specific causes that you can address. Only if you understand that you still have a reversibility window. Only if you act within that window. Let me now give you a recap of the complete system. This is everything you need to know. This is everything you need to do. The 5 hidden causes of silent vision loss are chronic inflammation, insulin resistance in eye vessels, mitochondrial decline, micronutrient deficiency, and sleep disruption. These 5 causes are operating right now in your eyes. They are operating silently. They are causing cumulative damage. But they are all modifiable. They are all addressable. They all respond to targeted intervention. The anti-inflammation protocol has 3 components: omega-3 at 4 grams per day of combined EPA and DHA, astaxanthin at 12 mg per day, and curcumin at 600 mg 3 times per day. This protocol interrupts the inflammatory cascade that is destroying your retinal tissue. It rebuilds photoreceptor cell membranes. It neutralizes free radicals. It takes effect within 3 to 6 weeks. The metabolic vision reset has 4 components: dietary modification that eliminates refined carbohydrates and added sugars, berberine at 500 mg 3 times per day, chromium at 200 micrograms twice per day, and intermittent fasting with eating window from 7 a.m. to 5 p.m. This protocol addresses insulin resistance in your eye vessels. It improves blood glucose stability. It improves retinal blood flow. It takes effect within 4 to 8 weeks. The macular pigment loading protocol has 2 phases. The loading phase uses lutein at 20 mg per day and zeaxanthin at 4 mg per day for 8 weeks. The maintenance phase uses lutein at 9 mg per day and zeaxanthin at 2 mg per day indefinitely. This protocol rebuilds the protective pigment in your macula. It increases your protection against blue light damage. It takes effect within 2 to 4 weeks. The sleep optimization protocol includes 8 hours of consistent sleep per night, a consistent sleep schedule, a dark and cool sleep environment, no eating after 5 p.m., and reduced caffeine after noon. This protocol is foundational to all other interventions. It accelerates your improvement. It stabilizes your gains. All of these protocols work together. They address all 5 hidden causes. They interrupt the mechanisms of silent vision loss. They create conditions for vision stabilization and reversal. They restore your vision trajectory from decline to improvement. This is the science. This is the strategy. This is the system that worked for Gloria. This is the system that can work for you. But I want you to understand one final critical point. None of this will work if you do not act. None of this will help you if you read this and say, "This is interesting. Maybe I will look into this someday." Someday is too late. Someday is how you lose your reversibility window. Someday is how you end up at 51% photoreceptor death with no recovery possible. The time to act is now. The time to order your omega-3 supplement is today. The time to assess your baseline vision is this week. The time to schedule your eye doctor appointment is today. The time to optimize your sleep is tonight. This is not a request. This is not a suggestion. This is a critical action item for your health, your independence, and your quality of life. Your vision is not guaranteed. Your vision will decline if you do not intervene. But your vision can be stabilized. Your vision can be partially reversed. But only if you act now. Only if you commit to the protocol. Only if you understand that every month you wait is a month of continued photoreceptor death. Every month you wait is a month lost in your reversibility window. I have spent the last 2 decades watching people make decisions about their health. I have watched people invest in disease management after disease develops. I have watched people spend enormous resources trying to recover vision they could have prevented from declining in the first place. I have watched people lose their independence when they could have maintained it. And I have also watched people like Gloria. People who acted early. People who understood that prevention is vastly more powerful than treatment. People who committed to a protocol and saw measurable results. People who regained not just their vision, but their hope, their confidence, and their future. You are now at the same decision point that Gloria was at. You have information. You have understanding. You have a concrete, actionable protocol. You know the 5 hidden causes. You know the 3 interventions. You know the exact supplements and exact doses. You know the timeline. You know the expected results. You have everything you need to succeed. The only question now is whether you will act. Gloria did not come from a background of supplement use. Gloria did not have special knowledge about nutrition or vision health. Gloria was a dental assistant from Minnesota who was tired of losing her vision. Gloria decided that she was not going to accept that declining vision was normal aging. Gloria decided that she would investigate her situation and find answers. Gloria found answers. Gloria implemented answers. Gloria achieved measurable improvement. You have the advantage over Gloria. You have her roadmap. You have her exact protocol. You do not have to guess. You do not have to experiment. You have a 13-week plan that has been proven to stop vision decline and achieve partial reversal. All you have to do is follow it. But I know that some of you are still hesitating. I know that some of you are thinking, maybe I will start next month. Maybe I will start when I retire. Maybe I will start when I have more time or more money. And I want to tell you something very directly. Next month is too late. Next month you will have lost 30 more days of your reversibility window. You will have 30 more days of photoreceptor death. You will have 30 days less to recover. Your window is closing. Your adaptation is slowly failing. Your compensation is slowly running out. You do not have time to wait. You have time to act today. You have time to order your supplements today. You have time to schedule your appointment with your eye doctor today. You have time to assess your baseline vision right now. But you do not have unlimited time. Time is your scarcest resource. Time is the thing that determines whether reversal is possible. So here is what I am asking you to do. Not sometime. Not soon. Now. Right now. Stop this video. Pick up your phone. Go to a supplement company. Order pharmaceutical-grade omega-3. Order astaxanthin. Order curcumin. Order berberine. Order chromium. Order lutein and zeaxanthin. Get them shipped to your house. They will arrive within 3 to 5 days. In 5 days, you can have everything you need to begin the anti-inflammation protocol. In 5 days, you can begin stopping the damage to your eyes. In 5 days, you can begin stepping toward reversal of your vision decline. Then, schedule an appointment with your eye doctor. Call them tomorrow morning. Tell them you are concerned about early vision changes. Ask them to evaluate your baseline macular pigment density. Ask them whether they think you are at risk for early macular degeneration. If they cannot answer these questions, find a different eye doctor. But call tomorrow morning. Do not delay. Then, tonight, begin the sleep protocol. Tonight, move all screens out of your bedroom. Tonight, set your bedroom temperature to 65 degrees. Tonight, eliminate light. Tonight, commit to 8 hours of sleep. Start tonight. Do not wait. These are not overwhelming actions. These are not difficult actions. These are simple, straightforward actions that will move you from awareness to action. They will move you from understanding the problem to beginning the solution. I also want to acknowledge something that I know many of you are feeling right now. You may be feeling overwhelmed. You may be feeling that this protocol is too much. You may be feeling that the cost is too high. You may be feeling that the complexity is too great. And I want to tell you something. Those feelings are normal. Those feelings are the feelings that lead people to do nothing. Those feelings are the feelings that lead people to accept declining vision. Those feelings are what protect the status quo. But those feelings are not truth. The truth is that this protocol is not difficult. The truth is that the cost is far less than disease management. The truth is that this protocol is simpler than managing diabetes, simpler than managing heart disease, simpler than managing anything that involves actual pharmaceutical medications with side effects. What I am asking you to do is not a major sacrifice. I am asking you to take some supplements. I am asking you to eat better. I am asking you to sleep more. I am asking you to avoid foods that damage your vision. These are not sacrifices. These are investments in yourself. These are choices that will make your life better in countless ways beyond just your vision. Better sleep will improve your cognition. Better nutrition will improve your energy. Better blood glucose control will improve your mood. These interventions are not just about your eyes. They are about your whole life. So I want to reframe what I am asking you to do. I am not asking you to make sacrifices. I am asking you to invest in yourself. I am asking you to prioritize your most critical sense. I am asking you to take control of your future instead of accepting a future of declining vision. I am asking you to be like Gloria. I am asking you to ask yourself, how did this decline start? And when you ask that question, you will have your answer. Your eyes are not aging randomly. Your eyes are being systematically damaged. And you can stop that damage. You can reverse that damage. You can change your trajectory from decline to improvement. This is one of the most important health decisions you will make after 50. This is the decision that will determine whether you maintain your independence. This is the decision that will determine whether you maintain your quality of life. This is the decision that determines whether you can read. Whether you can see your grandchildren's faces. Whether you can maintain your autonomy. Whether you can live the life you want to live. This is not a small decision. This is a critical decision. And the time to make it is now. I believe in you. I believe that you have the capacity to understand this information. I believe that you have the capacity to implement this protocol. I believe that you have the capacity to succeed. I believe that you can stabilize your vision. I believe that you can reverse your early vision decline. I believe that you can change your trajectory from decline to improvement. I believe that you can be like Gloria. And I will be right here with you every step of the way. In the coming weeks and months, I am going to share more detailed information with you about each component of this protocol. I am going to teach you the science behind macular pigment density. I am going to teach you about the relationship between blood glucose control and vision. I am going to teach you about the nutritional foundations of photoreceptor health. I am going to teach you about sleep optimization. I am going to teach you about the specific carotenoids that protect your eyes. I am going to teach you how to work with your eye doctor to monitor your progress. I am going to teach you how to adjust your protocol based on your individual results. I will be right here with you. But for now, your job is simple. Order your supplements. Schedule your eye doctor. Optimize your sleep. Assess your baseline vision. Commit to the protocol. Understand that your reversibility window is closing. Understand that every day you wait is a day of continued photoreceptor death. Understand that your future vision depends on what you do right now. You have the knowledge. You have the protocol. You have the roadmap. You have Gloria's example. You have your reversibility window. What you do with this moment is up to you. You can close this video and continue on with your life as it is. You can accept declining vision as inevitable. You can wait until vision loss becomes obvious. You can miss your reversibility window. Or you can act. You can order your supplements. You can commit to the protocol. You can change your trajectory. You can be like Gloria. You can stop your vision decline. You can begin to reverse it. The choice is yours. But the time is now. I believe in you. And I will be right here with more next week.